Hi, how are you today?
I'm good. How are you?
I'm good. My name's Violet. I'm going to be your nurse today. So today I'm going to be doing a head-to-toe assessment on you. Can you state your name and date of birth for me?
Lauren, 8/15/90.
All right, matches the bracelet. And I'm just going to close the door so we can ensure some privacy. Perfect. All right, and I see that you're sitting safely in the bed. Alrighty. So looking at the patient, she is erect. Her posture is calm, erect. Her facial expressions are pleasant. They're calm and appropriate for the situation. Her mood so far seems to be appropriate for the situation. Looking at her, I don't see any physical deformities. And I'm going to ask you a couple questions. So do you know where you're at right now?
I do. We're at an office.
Perfect. And then do you know who the President of the United States is?
Unfortunately.
Well, who is he?
Trump.
Alrighty. And then do you know what month it is?
June?
Yes. Patient is alert and oriented times 4. It will be July, just in case you were wondering soon. Alrighty. Patient appears to have proper hygiene, pretty adequate. She looks pretty well groomed. No physical odors are present. She also appears to be well nourished, so all in all, she looks like very healthy from the outside. And I'm going to assess her skin. So I'm going to take a look at your arms. Alrighty. And if at any point in time there's any tenderness, Lauren here will tell me and we can stop the process. So I'm just feeling. So her skin is even, intact. It is warm to touch, slightly dry, which is appropriate, and this is bilaterally. And I'm looking at her hands. Her nails are intact, no striations indicated, nice and smooth. And I'm just going to do her cap refill, which is brisk, 3 seconds. And I'm going to have her go like this. Awesome. And there's a nice space in between those 2 fingers, which indicates no clubbing. So that's awesome. Alrighty, so I'm gonna look at Lauren's ears here. Alright, looking at the right ear, looks intact, and the left ear intact, so both ears are intact bilaterally. No crust on the outside. Awesome. And she's got earrings, everything looks equal, and no physical deformities as seen. Her face appears symmetrical. Are you able to raise your eyebrows for me? Can you smile? Can you frown? Can you puff your cheeks out? Perfect. Her cranial nerves 7 is intact. Perfect. Alrighty. And I'm going to do a whisper test. We're going to test her hearing acuity. So whatever I whisper into one ear, she'll tell me what I whispered and then tell me which ear it was from.
Peanut butter, right. Chocolate, left.
Perfect. So the cranial nerve 8 is intact bilaterally. Alrighty, and then actually, I'm getting up. I'm gonna, if you can slightly turn to the left for me. Perfect. Alrighty, so I'm just gonna palpate Lauren's head here. We're just looking for any lumps or bumps, and Lauren's. Lauren's cranium seems normal cephalic, no lumps or bumps or any physical deformities present. I'm not gonna have her tip back. Alright, don't see any dandruff, no pests or anything. And hair is evenly distributed throughout her hair. I don't see any bald patches or anything like that. So golden there. Alright, and then I'll have you shift this way for me. Perfect. Alrighty, so now I'm gonna assess the facial features. So I'm gonna look at her pupil size. Her pupils appear to be 5 millimeters. Perfect. And I'm gonna shine this light right in between your nose, so if you could look straight at me. And awesome. Corneal light reflex is there. Light is in the same spot in both areas of the eye. And then I'm gonna have you cover up one eye for me. Awesome. And then cover up the other eye. And then uncover Perfect. Pupils pupils constrict according to light and accommodate. And then I'm just going to take a look at your eyes here. So her eyes, the sclera appears white. There's no yellow or anything like that. Her irises are consistent with her color, which is a beautiful green. I'm going to apply some pressure on the bottom of your eyelids here. And her conjunctiva, it looks pink, no redness, so that's no signs of indication of infection. Alrighty, so now I'm going to palpate her sinuses, and she's still going to tell me if she feels any tenderness. I'm going to do her maxillary. Alright, and then her frontal. Perfect. So non-palpable, no tenderness there. And then I'm going to do her temporal mandibular jaw. TMJ. There you go. All right. So I'm going to have you open your mouth for me and close. Awesome. So the TMJ has no crepitus. It has nice smooth transitions to it. So looking on the outside of her nose, it appears symmetrical. And I'm going to have you close one of your ears. Awesome. And then your other one. All right. So the patency in both of them is bilateral. And perfect. Alrighty, so now we're gonna do your visual acuity. So I'm gonna have you cover up one eye. Alrighty, and then whenever you see my hand, you tell me when.
No.
Perfect, and we'll do the opposite one.
No.
Perfect. Alrighty, and then I'm gonna do the cardinal field gaze. So you will look straight at the pen at first, and then you'll move with it. Perfect.
I definitely had a nystagmus.
Patient has no nystagmus. Her EOMs are intact. That would be 2, 3, 4, and 6. They're all intact bilaterally, and no nystagmus indicated at this present moment. Alrighty, and then we're gonna look at her mouth. On the outside, appears pink and moist. Now I'm gonna have you look, you're not gonna look, silly me. I'm going to look inside your mouth. Alrighty, so I'm gonna have you stick out your tongue. Alright, her tongue is, when it's erect, it is medially. And I'm gonna have you say, sorry, yeah. Alright. Alright. Uvula raises medially in the back, and then I can open up. Mucosa is pink and moist. Her teeth are white, intact in the gums. Her tongue is pink and nice and rough, and her teeth seem intact and inside the gums. So everything is checking out in her mouth there. Alrighty, so now I'm gonna test your trigeminal nerve with a light and kind of sharp sensation. Just use this one. So it'll either be on your forehead, cheek, or chin. You let me know whether it's soft, sharp, and which area. So close your eyes for me.
Soft.
Perfect. Is on where is it at?
The right side of my cheek.
Perfect.
I think sharp.
Yep.
Soft.
Mm-hmm.
Sharp.
Mm-hmm.
Soft.
Perfect. So Lauren's trigeminal nerve is intact, bilateral. She's able to indicate whether that's a light or a sharp touch, which is what we're looking for. Alrighty, so now that we've covered the head area, I'm going to go to the neck area. So I'm going to palpate her carotid arteries. I'm not going to do them at the same time. Beautiful. They're both a +2. And now that we've palpated those, I'm going to do her lymph nodes. We're going to start with the preauricular, and then you'll just tell me if you feel any tenderness. A-okay?
Mhm.
Cool. And these don't feel any palpable. We're going to the post-auricular. Any tenderness?
Mm-mm.
And they're non-palpable. And going to the submandibular?
Mm-mm.
No? Awesome. Non-palpable there. And then we're going to the occipital.
Mm-mm.
Any tenderness? Awesome. And I wasn't able to palpate any of those. Well, I was able to palpate, but they're not palpable, and there's no bumps in your lymph nodes. Alrighty. Alright, so now that we've done all that, we're going to test some neck muscles. So I'm going to have you tuck your chin to your neck. Beautiful. And then go up to the sky, and then ear to shoulder, and another one. Perfect. And then we'll try neck muscles. So you'll go against my hand, and then go against the other one. Awesome. So, nerves 12 are intact, and her muscle strength is a 5 out of 5. Beautiful. Alrighty, so now we're gonna go to your chest area, and I'm gonna auscultate your lung sounds. Alrighty. Perfect. Take a deep breath for me. Perfect. And again. Perfect. I'll have you raise your right arm for me. Breathe in. Perfect. Breathe in. Perfect. Perfect. I'm going to listen to the lower portion and move your pocket. Kind of right there. Actually, here we go. Beautiful. And going to the other side, and I'm going to listen to the lungs on this side here. Sorry if you're ticklish. Perfect. And then lower liver. Perfect. Lauren's lungs are clear and equal bilaterally on auscultation. And then I am going to listen to her heart now. Alrighty, we're going to start at S1 over here with the diaphragm. I'm just going to move your shirt to the side. Awesome. Perfect. And I'm actually going to have you lean forward for me. Perfect. I'm going to continue working my way down. I'm actually going to have you move this real quick. All right. Alrighty, and I don't know. Just let me know if I'm hurting you. Alrighty, and then I'm gonna go to the apex, so I'm gonna palpate this. Sorry.
Okay.
And this would be found 5th intercostal mid-clavicular line. Perfect, and I found it, so I'm gonna auscultate that. Awesome. Now we're gonna go backwards, but we're gonna listen with the bell. We're listening for any heart murmurs. It's crazy how it has a suction. Sorry.
No, you're fine.
Alrighty. Lauren's heart sounds sound normal. No irregular heartbeats. If there was any murmurs, or if the apex was abnormal, we would listen and auscultate for a minute straight. Alrighty. Alrighty, so I'm sorry. Alright, I'm gonna get underneath here. And I'm gonna have you take a deep breath. And out. Perfect. Her chest expansions, inspiration and expiration are bilateral there. Alrighty. And now I'm going to the posterior portion of the chest. And looking back here, her shoulders appear to be symmetrical and equal. And then I'm going to have you bend over, ensuring that she's nice and safe and doesn't go over the breath. And I'm just going to lift up her shirt just a little bit. Perfect. And her spine is aligned and symmetrical. And now I'm going to palpate down her spinous processes. Perfect. And they are all intact, which is what we're looking for. And then I'm going to have you shift a little to the left. Alrighty, and I'm going to auscultate her lungs. I'm going to have you take a deep breath. Perfect. Again. Perfect. And again. Perfect. And one more time. Actually, I lied. One more time. Beautiful. Her lungs are clear and equal on auscultation bilaterally. And I'm going to have you take a deep breath for me again. All right. And posteriorly, her chest expands on inspiration and expiration bilaterally. Alrighty, and so now I'm going to palpate the kidneys. Well, actually, I'm going to tap on the kidneys. You let me know if you feel any pain, okay?
Nope.
Alrighty. Ready?
Nope.
Awesome. Negative test there. Alright, and then I'm going to have you move back this way. Alright, so before we move to your abdomen, I'm going to check your arm muscles. We're going to see how strong you are here. Cool. So I'm going to have you flex up for me. Perfect. And then do resistance. Perfect. Alright, and so her muscle strength is 5 out of 5 on that. And then I'm going to palpate her radial pulses here. Perfect. Both radial pulses are A+2. So she's golden. I'm going to have you lay down for me. I'm going to have you lay down on your left side first, though. And, poop. Alrighty. It's a tight spot, but we'll get in there. Okay, I'm just making sure it's recording still. Oh, would be sad. Alrighty, so I'm just gonna listen to your apex here. Alright, and her heart is sounding normal with regular beats. Alright, so I'm going to have you lay flat on your back. Alright, and I'm going to expose you. Are you okay with that? Okay, well, yeah, I have to expose you. Okay, perfect. Coolio. Alright, so looking at her tummy, it appears flat while she's laying down. It appears soft, which is what we're looking for. Her umbilicus is medial. So far on a physical appearance, it is looking A-okay. Alrighty, so I'm going to take a listen to your bowel sounds, and we'll listen to each quadrant for 15 seconds. If we were to not hear anything, we'd listen for a full 5 minutes. I'm sorry if you're ticklish, but... Perfect. And if that wasn't a full 15, we're going to pretend it's a full 15. Perfect. And I'm just going to move this just a little bit. There we go. Perfect. And again. Perfect. So normal bowel sounds and normal active bowel sounds in all 4 quadrants. So heard some bowel sounds there. So now we are going to percuss each quadrant. And then you just let me know if anything at any point hurts, okay? Alrighty. All 4 quadrants sound tympanic and percussion. If I were to palpate her or percuss her right upper quadrant, it would sound dull because of the liver there, but we're not going to do that for right now. Alright, so now we're going to go into palpation. Lauren stated before this video that deep palpation can't be done just because her abdomen area is tender. So I'm going to do light palpation and then verbalize deep palpation. So light palpation at first. Her skin is feeling soft, warm, and intact here. Nice and soft here. Everything, no tender, no hard or dull areas. Actually, it wouldn't be dull, it would just be hard. Awesome. And then after the light palpation, we would do the deep palpation. So her abdomen area is looking a-okay. Perfect. Alrighty. Have you sit up for me? Perfect. How you doing so far?
Good.
Alrighty. So I'm actually going to take off her shoes here.